Are primitive reflexes linked to autism toileting issues? Imagine trying to learn a new skill when your body keeps sending mixed signals. That's what toileting can feel like for some children with autism. You might wonder why it's so hard for them to get the hang of it. Well, one piece of the puzzle involves primitive reflexes. These are automatic movements babies are born with that help them survive and develop. Normally, these reflexes fade away as the brain matures. But in children with autism, some of these reflexes stay active longer than they should. This can influence how they move and respond to their environment. When primitive reflexes linger, they can cause motor control issues. Toileting needs a lot of coordination, balancing, sitting still, and managing clothing. If reflexes like the asymmetric tonic neck reflex or the Morrow reflex are still active, it can make sitting or balancing on the toilet tricky. This often leads to clumsiness or awkward movements, making toileting frustrating. Sensory differences are also common in children with autism who retain primitive reflexes. Some kids might be overly sensitive to the feeling of water, toilet paper, or clothing. Others might seek out extra sensory input, which can make the routine uncomfortable or overwhelming. These sensory sensitivities can cause children to resist or avoid toileting altogether. Developmental delays are another factor. Children with retained reflexes often reach milestones like crawling or walking later than typical. These delays can slow down the development of the muscle strength and coordination needed for independent toileting. Without these foundational skills, learning to use the toilet can feel like a big mountain to climb. Neurological regulation plays a role too. Retained reflexes are linked to heightened stress responses. Toileting can be stressful because of unfamiliar routines or sensory overload. If a child is already in a heightened state of stress, it's harder for them to relax and successfully use the toilet. Understanding this connection helps explain why toileting issues are common and persistent in children with autism. Therapies like occupational therapy can target reflex integration. These involve specific exercises to help the brain suppress or integrate retained reflexes. Improving motor control and sensory regulation can make toileting routines easier and less stressful. Creating a predictable, sensory-friendly environment is also helpful. Using soft lighting, calming sounds, and familiar routines can reduce anxiety. Gradually introducing toileting steps and offering consistent support can build confidence and independence. Addressing retained primitive reflexes is a practical step in supporting children with autism. It can lead to better motor skills, less sensory discomfort, and smoother toileting routines. Every small improvement helps children feel more confident and independent in their daily lives.